which is run by the same people as Sahara. And we started our placement in November, and while Sarah and I were there, the election strikes were happening, so we ended up only doing 2.5 weeks of the 4 weeks. Yeah, so this is Sahara, and this is the Orthoplast Center. Sahara is reportedly reputed as being the first complete physio facility in Nepal, with both inpatient and outpatient services, and so it had regularly volunteers coming in and out. This building had 5 levels, where the first floor was dedicated completely for treatments, while the rest of the levels above were just for patients to board. So usually the ones who've had a stroke or a neuro disorder stayed for months and even up to years. There was one guy there who stayed there for up to 4 years, and until they can be taken back home. So the ground level was split up to 2 departments, the electrotherapy and the manual therapy. There was also an OT room there, but it wasn't really being used unless there was a volunteer there. When we first arrived, we had 0 expectations, but considering that the center was supposed to be pretty modern, our first impression was that it was pretty much in stark contrast to Australian clinics. Beds were made out of wooden blocks and non-adjustable. Progress note keeping was unheard of. Hemiplegic patients were being lifted straight from the wheelchair by 2 young men. And so they actually had a shortwave diathermy machine, which they did use. And so these were just some examples of a long list of issues we identified just on day 1. And unfortunately, these practices extend across town, and Jordan experienced them as well.
Just to clarify, I'm not a physiotherapist. I'm actually studying to be an occupational therapist, but I was put into a physio placement. So this was one of my first roadblocks, is because over there they had absolutely no idea what OT was, what we do, or anything. So because of this, the first few days was really daunting, and a lot of the physios there had quite high expectations of me. So they said, stretch that patient, ultrasound him, or do balance exercises with her. Imagine if I asked you guys to do that right now in this room with these resources. You'd probably have the same, ability as I did back then. So I didn't know any of the exercises. I didn't even know how to turn on that ultrasound machine. I didn't know if the patients could speak English, and most of all, I actually didn't know what was wrong with them. So they gave me no information to actually help anyone. So a key central theme in occupational therapy is client-centred practice, and you can't be client-centred if you can't communicate with them, and there's no way of figuring out what is actually wrong. Therefore, this hindered my ability to be actually helpful and useful in this particular placement, which was quite unfortunate. To try and overcome the language barrier, I always asked for more information, lots of open-ended questions. I tried to probe and draw something out of either the physios, the patients. Sometimes I even resorted to asking other patients to translate for me. So eventually this usually worked, but it just took a lot of time and effort, which, as was said before, this is perfectly okay in Nepal and especially Orthoplast, but isn't really acceptable here in Australia. It makes me realise just the conversations that we have here in Australia, both socially and clinically, how easy and how good we have it. I believe it helped with my practice back here. I learned a lot about patients and how to approach questions from different angles to get my point across. I also learned how to be respectful and really actively listen. I managed to overcome some tricky points by trying to stop understanding the system over there. I stopped trying to do things that I just simply couldn't do, and I stopped trying to be useful and helpful as a physio, because that's not what I am. I started implementing some occupational therapy interventions, simple things, just like asking a client what is important to them and what they actually want to do. Suddenly everyone had an answer to this question, and it was actually really amazing the difference that I could make. I asked a wife of a hemiplegic patient what she wanted to see her husband do, and she answered, I want him to play a board game with me. And to be able to do that, I proceeded to simplify a board game that they both liked, made him slide the pieces instead of trying to pick them up, and put the dice in his hand and drop it rather than having to manipulate it. So just to see his face and his reaction, it really helped to make a difference.
So the biggest challenge for all of us was probably deciphering what our role was supposed to be. We were not told what to expect by Projects Abroad or Sahara or Orthoplast. So we spent the first half of our time there trying to get around this concept of being a volunteer and trying to instigate change. So Australia is a leading country in physiotherapy, and I think we put too much pressure on ourselves in the beginning, as we knew these facilities had plenty of room for much needed modifications. It didn't help that we weren't really qualified physiotherapists yet, and our previous clinical experiences back home had little to do with neuro rehab. So we realized that we weren't meant to be here to enforce massive changes and have unrealistic goals and overstep boundaries without meaning to at the same time. So how we overcame this, one of the benefits of two people being at the same site was experiencing the same things and having plenty of discussions about what we learned or observed that day. So we did a lot of reflecting, and we realized the value of this being only students, and this resulted in Sarah and I being able to bounce ideas off each other a lot. Getting to know the therapist and learning the language and familiarizing ourselves with Nepalese culture also allowed us to tackle our challenges better. We had open discussions with some of the younger physiotherapists over there, and this gave us an idea of how their mindset was. So this also helped us in trying to decide which ideas would work and which wouldn't. So although we were unmotivated at first because of the dilemma we were in, something that did help us was being proactive and not simply standing around doing nothing and just observing. So we asked to be given patients, and Sahara was good enough to actually give us patients to work with, and we ended up developing a routine each day, and as a result, we were able to improvise with the little equipment that we had as well. So these are some of the photos of us.
Another thing I tried to contribute to Orthoplast, and especially to the physios, was a little bit of education outside of their normal field. So including stroke rehabilitation using mirror therapy, home modifications, equipment modifications, and the practice of distraction during pain, or to reduce pain, and to manage it during their treatments. I had to tread lightly when I was trying to express these new areas, so as I wasn't dictating to them, because often that makes people put up some barriers. I was grateful and amazed at how well they took on some of the things that I had to offer on board. I introduced things to the patients first, while they were waiting and just sitting around, and like it was said before, they just stay, just to chill. So when I did that, it kind of started to intrigue the other physios about what I was doing and why the patients were actually enjoying themselves. My most successful activity was using my Samsung tablet with the children during their stretching of their skin contractures and their scars. This was a really horrible experience to see, to watch these kids cry and be screaming and stuff. But as soon as I gave them my tablet to draw pictures on, they became a lot more relaxed, they were in a lot less pain, and they actually had greater range of motion while they were getting their treatments. Because of this, I saw the physios start to actually engage with the kids. Instead of just treating them, they were really talking to them and telling them jokes. Just to make them laugh and to distract them from the pain that they were going through, which also helped to lift the atmosphere around the whole clinic. So, we weren't having to just listen to these kids. Although it wasn't a direct intervention, it did create some small, manageable and sustainable changes for Orthoplast.
So one of our main concerns was the way the patients were being treated very passively, and they used stretchers way too much. So they would be spending more than half of the treatment just doing the same movements on each patient over and over again without tailoring the exercises for their specific impairments. So we understood that this had something to do with the fact that there was a cultural and social difference in the way patients and their families coped after a stroke. Independence in activities of daily living was not really something they enforced over there. And so functional and dexterity exercises were often neglected or not prioritized. So that's an example of passive treatment. So Sarah and I had to focus on little things that had the potential to be significant and sustainable. So we gave the therapists an in-service on the use of the tilt table. So currently they were only doing 15 minutes, and they're only doing 15 minutes of it and no exercises and no supervision. So when we did our in-service, we bribed them with cake, and it was a good turnout as well. We gave them little tips on extra exercises they could do and the benefits of each. We even got one of the physios to be a volunteer. And although they didn't really listen for long, their attention span is really short. Hopefully we got them thinking about making sure that they're still learning and continuing to fine-tune their skills, as this was not really a concept they were used to, and quality improvement isn't something they really prioritized. So we also left them with hard copies of the stroke foundation protocols. And on top of that, we believe that we were able to teach them something indirectly just by leading by example. So although we were students and they knew this, we showed the Australian way of practice, and this included the rapport we had with our patients despite our inadequate knowledge of Nepalese language. By the end of the placements, we were actually noticing that a lot of the therapists were adopting little things that they weren't doing before, and that we were like simple things like putting the feet down on the floor and doing sitting balance. What we learned, clinically, we were able to be innovative and improvise with what we had. We learned the value of body language and how to build a relationship with patients despite the absence of language. We learned that actions do speak louder than words, rather than pushing issues verbally, especially to elderly patients. We also learned that changes don't have to be big to be effective, and little can be significant. That's it.
Just to wrap it up, the FHS abroad is definitely a huge opportunity, both for the students and the clinics that we were placed in. It encourages a lot of development, overcoming language and cultural barriers, both on our part, but as well as theirs. It shows the importance of health professionals with the resources that we can give them, the practices, skills, and just research, and that exchange is really important. So this program granted us with a priceless opportunity that will definitely stay with us for the rest of our lives. You guys like any questions?